Can I get some help in here?
Is
Where's
someone
the
on pulse
IV?
cardiac arrest?
Someone
Grab
grab the
the
crash
crash
card.
Who's on
Pushing
pads?
1 milligram of
Can someone check my
Where's
blood
the ambu
pressure?
bag?
What you just witnessed was the chaotic environment of an in-hospital cardiac arrest.
In these moments, every second matters. Managing a cardiac arrest in the hospital is one of the most stressful things I do in my daily job. Roles blur, communication breaks down, and critical interventions can be delayed.
As a result, over 292,000 patients in the US die annually from in-hospital cardiac arrest. During this stressful situation, doctors are expected to follow the time-sensitive and complex American Heart Association guidelines exactly and entirely from memory. This system sets them up for failure.
And it's no surprise that errors are common. Research has shown that just one error can reduce a patient's chance of survival by up to 50%. And over 40% of cases involve physician error. Medication errors are the most frequently documented, but if you ask any clinician, they'll tell you that many more go unreported. And that's because of the current standard, which involves scribbling notes on a whiteboard and filling in the missing details later. This is the system we have relied on for years. Do you think it would be possible to accurately keep track of what has been done and what needs to be done? The truth is, we can do better, and that's why we built CodeClock.
Introducing our second prototype. After clinical feedback, we developed a third version. This device has been engineered to follow the American Heart Association Advanced Cardiac Life Support Guidelines. With flashing lights and timers, we can help keep the clinical staff on time and reduce errors. With CodeClock, the team will be able to record medications and identify key tasks and roles that need to be completed for the patient. And at the end, an EMR-compatible summary report is generated, giving the team accurate line items of everything that occurred during the cardiac arrest, down to the second. This simplifies documentation and saves the team time.
You might be asking yourself, what is the market opportunity? We are targeting 3 major hospital groups: academic and research hospitals, where they focus on training residents and data collection for research; for-profit hospitals that are looking for operational efficiency and improvement of ranking, which leads to better insurance reimbursement rates; and community and critical access hospitals that need support due to resource constraints.
Hospitals will have one device on each cart throughout the hospital. This is a $957 million operational market in the US alone. Looking at all of North America, this expands to an addressable market of $1.8 billion across the academic and research, for-profit, and community and critical access hospitals. The total addressable market pushes up to a massive $7.1 billion when we include European hospitals. The future also looks expansive, as the cardiac arrest treatment market is expected to grow at a 5% CAGR from 2025 to 2031.
We're pursuing a hybrid hardware as a service model, where hospitals will purchase CodeClock as capital equipment for $1,500 and pay a recurring service fee that covers things like device warranty, software updates, and resuscitation analytics. We will reach the market much faster than other medical devices for 3 reasons. The first is training. By working with simulation centers, we will train the clinicians on our device while they are renewing their advanced cardiac life support certification. Second, we have strong traction within the University of Utah Hospital. Multiple departments have already expressed interest in being pilot sites once the device is ready. And third, our regulatory burden is low. CodeClock is expected to be classified as a Class 1 510K exempt device, minimizing both our time and cost to market.
As you can see, our device is vital and alleviates many pain points. CodeClock stands to surpass our competitors in 3 key areas. Visualization: the time and status of the code is visible to the entire team, and providers are prompted to perform time-sensitive interventions. Assigning: clinicians assign themselves roles as they enter the room and check off tasks as they are completed. And documentation: at the end of the code, clinicians receive a timestamped report and summary that can be uploaded into their EMR.
To reach our next milestone, we're raising $300,000 for device development and to run a 1-year clinical trial here at the University of Utah Hospital. This milestone will provide us the necessary data to show how effective CodeClock can be.
We are asking you to join us in our journey to revolutionize in-hospital cardiac arrest care by saving lives 1 heartbeat at a time.